Wash my hands. Provide for privacy. Hello, Mr. Smith. My name is Desiree, and I'm going to be your student nurse today. I'm here to just do a routine assessment and take a peek at that chest tube dressing, if that's okay with you. And he states that it is. Can you please tell me your full name and date of birth? And I would compare that to his armband and on the records that I have, and it matches. Do you have any questions or concerns before we get started? And he says no, this has been done before. So I have my supplies. I just need gloves and a stethoscope. I'll wash my hands again. So they already got your vitals for me and they all look great. I'm going to keep a close eye on your oxygen saturation and your respirations, and I would also note his respiration effort. So I'm going to listen to your lungs, Mr. Smith. I will do, is it okay if I lift your gown for just a minute? Thank you. So I will do 8 in the front. Listening for any adventitious lung sounds. I would do 2 on the side. And then if he is able, I would have him sit forward so I can listen to the back in the 10 areas. I would also want to be looking for cyanosis, any pursed lip breathing, or any cough, which he is not exhibiting. I can then look at his dressing. Okay, Mr. Smith, I'm gonna open your gown a little again here. So I would note any drainage, any breakthrough, shadowing, which he does not have. And I would palpate for any crepitus, which sounds like popping or cracking like Rice Krispies. And you want to go all the way up because air can travel. And this is all good. Okay, thank you. He doesn't have any continuous bubbling, but if he did, I would want to take the hemostat that we keep at the bedside along with a sterile occlusive dressing and sterile saline. If he would get up and ambulate, you would want to take that with in case anything would happen. So you take the hemostat to try to detect for where the leak is located. You would occlude the tube and watch the bubbling. And when the bubbling would stop, you would know that the leak is occurring behind where your fingers are. You want to check all the connections, make sure that they're secure. And if you get all the way to the collection device and it's still bubbling, you want to replace that sterilely and see if that fixes the problem. So Mr. Smith, every 2 hours, I want you to try to reposition and do some deep breathing and some controlled coughing. We want to expand those lungs to prevent any pneumonia from happening. Keeping the collection device below chest level is extremely important. We don't want any backflow to happen because that could cause some infection. And then, are you experiencing any pain right now? And he says, I'm maybe at a 1, it's just a little uncomfortable. I was like, okay, how about when you get up and ambulate or when you move around? And he says it does get a little worse, like a number 2 to 3. Okay, so I will document that and maybe I can get some pain medication for when you get up and ambulate with therapy. I want to make sure there's no dependent loops. And then I will get down and check my levels. And I want to put a mark of where it's at with my initials and the date and time so that we can track the accumulation. For lifespan considerations, if this was an elderly that had dementia or was confused, you would want to check on them more frequently to make sure that they did not dislodge the tube. I would take off my gloves. I would wash my hands. I would put down the bed. Give them the call light. And I would document any of the assessments I found, the interventions, and the education I provided. That was it.